Next presentation will be Thangan, Dr. Thangan.
Yes, sir.
His
Mrunal,
presentation will be AI-based equipment in dry eye diagnosis.
yes. Good evening, respected judges and all present here. I will be discussing on the AI-based equipment in the dry eye diagnostic. I have no financial disclosure. Artificial intelligence has taken its grasp over the healthcare system, and ophthalmology being one of the most dynamic stream which is largely influenced by the AI. AI-based imaging software have made the diagnosis of dry eye diseases easier. Currently, many studies have come up with the promising result of AI-based algorithm for the accurate diagnosis of dry eye diseases. Artificial intelligence in the field of dry eye utilizes the machine learning, which is help to interpretation of the non-invasive breakup time, interferometry, and deep learning approach about the mammography. Dry eye market is flooded with a number of imaging devices like corneal topography, AIOS2025 interferometry, wavefront and urbometry, tear lab osmolality system. So it is not feasible for every ophthalmologist to buy all these devices. So here comes the role of multi-imaging integrated devices. The purpose of our study to assess the effectiveness of novel dry eye analyzer created by the artificial intelligence in the diagnosing a patient with the ocular surface disorder. It is a prospective study with ethics committee approval, and informed consent has been taken from all the individual. First we send the patient for the ocular surface index questionnaire, then subjected to the dry analyzer, followed by traditional Shermer's test, and lastly the ocular staining. So ability to distinguish between the aqueous deficiency dry eye from the evaporative dry eye, it helps for detecting and treatment modality of the disease. Dry analyzer has four components. First is a non-invasive breakup time, tear meniscus height, infrared mammography, and the lipid layer interferometry. The non-invasive breakup time utilizes the Placido disc with the projection of visible light and then look for the image distortion. It gives the first breakup time, average rupture time, and the image distortion, and it generates the heat map. Second is the tear meniscus height. It is measured by using the inbuilt ruler in line with the pupillary center, and above two image shows the normal tear meniscus height, which is more than 0.2 mm, and below two images show the abnormal tear meniscus height, which is less than 0.2 mm. Third is the infrared mammography. It is work on the principle that infrared light is projected to the autofluorescence, and it is shows the healthy meibomian gland. First, this image is obtained and then AI image is applied to detect the meibomian gland loss. The lipid layer interferometry uses the adequate light hit to the oily layer of the tear film, and it generates the colorful interferometric fringes. The healthy lipid layer thickness is seen with the colorful interferometric fringes, and colorless reflection is seen in a patient with the thin lipid layer. So this is our result. Looks like 13% of the patient with abnormal Shermer's test, 36.25% of the patient with abnormal infrared mammography, 43% of the patients show the thin lipid layer. The result shows the out of the 100%, 72.990% of the individual is having the dry eye. As we compared the all parameter together, here our result showed 16.40% of the individuals show the all parameter positives. So what we already know about multi-imaging integrated devices, they are automated in nature, non-invasive, less time consuming, and the monitoring is easier. What our study had is meibomian gland diseases, abnormal lipid layer thickness contribute more than 50% of the cases. The cases missed by traditional test can be detected. Dry analyzer when used in a conjunction with the traditional test is complementary. So limitation of our studies, standardized image format and analyzing the model. The transitional potential, we can go for the image-based targeted therapy. The color-coded report help to raise the patient awareness and compliance, and precise monitoring of treatment response. Thank you so much.
How much will it add to the cost in the practice, like to the doctor?
For dry workup, ma'am, it is
Like how much will it cost the machine?
machine is around 1.25 like. It is costly.
1.25
But
lakhs.
ma'am, it is
Yeah, that's what I was clarifying.
but ma'am, it is standardized, more precise and accurate result is obtained.
What is your experience about the AI? How much it is giving false impression about the, because many cases they are giving a false impression.
Sir,
Do
in
you have
our
that
study, it gives the accurate diagnosis, and after treatment, patient is improving. in
See,
rapid
for
case.
that kind of an analysis, you should do what is the sensitivity rate, what is the specificity rate, what is the false positive, how much is the false negative. Then only we can conclude whether we are superior or AI is superior. Are we missing anything, or AI is picking something which we can't pick? So
Yes, sir.
that type of analysis. I think while submitting the paper, you are wrongly selected a Lacrimal instead of the OST, right? That's why you are only one paper odd man out in this session. Okay, thank you.